Number 7, Rolli KHURANA.
I can see the. A very good afternoon to all of you. So I'll be presenting a rare case of white eye seen in a child because of mumps. So we had a 4-year-old female who had a white eye which was noticed by the mother and not by the patient herself, and it was associated with very mild fornical redness, and there was no other positive history except that the child had just convalescent from mumps a week back. So the child was not complaining, and this was a problem here because it could have led to some kind of a vision deterioration which we would have not been able to handle later on. So the vision in the left eye was hand movement and PR was accurate, IOP was within normal limits, there was diffuse conjunctival congestion, and there was stromal edema with Descemet membrane folds. AS, OCT or specular could not be done at this point because at this point the child was symptomatic and slightly uncooperative. So this was a clinical appearance at the initial presentation, and the B scan was done to see that the posterior segment was fine. So in the list of pediatric corneal diseases, we could really point out to viral keratitis. So coming to mumps, it is a paramyxovirus, RNA single-stranded virus with an annual incidence of 100 to 1,000 cases in a 100,000 population. Primarily, it causes swelling of the parotids, parotitis, and spreads through lymphoid tissues. And viremia lasts for 10 to 12 days. So in this 10 to 12 days picture, we could see that the eye got affected. So other organs, inflammation of the meninges or the pancreas or the ovaries and the heart can also be seen in deafness. So coming to the ocular manifestations, keratitis alone is like the rarest, as has been reported earlier. The most common is dicryoadenitis and then other inflammation of any other part of the eye. So coming to mumps keratitis, the onset is 2 to 11 days after the onset of the parotid swelling, and it is usually unilateral as it was in our case, and there's rapid corneal clouding, avascular interstitial keratitis with stromal edema, Descemet folds, and there could be microcystic epithelial edema and associated with iritis. In our case, we did not find any iritis associated. So we just started the patient on prednisolone 1% QID with pressure lowering medications, that is a timolol, and a sodium chloride drops with cycloplegics. Vision improved rapidly and the patient quite recovered quickly, and this is a picture that was taken 2 weeks after the treatment. So final outcome at 6 weeks, the patient was back to 6,6, but there was a reduced endothelial cell count. As you can see that the cell density, the variance, all of them have been affected in the left eye. So why are we discussing this case? It is a rare case of isolated keratitis. It is a young child, the youngest ever reported. And the most important is that since 2020, from the universal immunization program, mumps vaccine has now been removed. So there has been a surge of cases that has been seen since then. So this is a rare case, and there have been only 6, this is the 6th reported so far. And there have been 5 cases earlier. The youngest that was reported earlier was around 8 years, and this is the youngest child that we've seen till now. So since it was excluded, there was a sudden surge in cases of mumps, and it was very sad to see that when we asked the patients if she was immunized for mumps, and she told that no, we were not immunized because we were told that we don't need the immunization now, since they were from a government, from a background where there was only government facilities available. So 764 cases of mumps have been reported in 2021 and 22, which was again underreported. Many would not have been followed up. So coming to the conclusion, accurate history and high clinical suspicion should prompt management to reduce endothelial cell function. Had we diagnosed it even later, we would have seen a further or maybe even an irreversible endothelial cell dysfunction. And with the exclusion of MMR vaccine from the UIP, that is the Universal Immunization Program, a surge in the cases of mumps, possibility of ocular complications should always be kept in mind in such cases to avoid such sequelae. Thank you.